Old Guy Talks is all about creating a kick-ass life for yourself and those that you love. Don't wait, don't hesitate, don't procrastinate. Opt in now.
Cabeca.
All right. This is Oris, the old guy from www.oldguytalks.com, here with Dr. Anna Cabeca. And yes, we're going to be talking about vaginal atrophy, vaginal rejuvenation, and some of you didn't even know that's possible. But before we do that, Sue, the IP lawyer, wants me to read this. This is information only. Consult with a proper professional before starting any program. Don't be stupid. You're responsible for your own shit. The old guy's a capitalist and not a socialist weasel. He may be promoting stuff here, and he may be compensated. The old guy only promotes stuff he uses. You will have different results. So that's, we got that little big.
Oh, I love it. I love it. Oh my God, I'm going to totally pirate that.
You got it. I'll send you a copy of that. So Dr. Cabeca is triple board certified in gynecology, obstetrics, integrative medicine, and anti-aging regenerative medicine. She's the author of her book, The Hormone Fix. You got a copy of that?
Yes,
let's
the
show
Hormone Fix. Yes, thank you.
That's right. Okay. And she has many programs on her website. And I'm just actually going to show that website down here in the comments section now. And she's got stuff that's called sexual CPR, women's restorative health, magic menopause, and other programs. She was named the 2018 Innovator of the Year by Mindshare, the #1 conference for health and wellness influencers. She basically, her mission is to inspire, and she's done it for hundreds of thousands of women, to reclaim their optimal health and realize they can journey through menopause and find more purpose and pleasure than they ever dreamed possible. And she's also the hostess, and you must have, I'm going to get some static for using this, a non-gender pronoun, hostess, instead of her podcast called CouchTalk. Mm-hmm. And so she's a very, very busy woman in gynecology, and she lives in Georgia. It's in a place that sounds like very, very idyllic.
It's a great place to live. Thank you.
I bet it is. So you have I've been talking now for the last 5 minutes. You have a personal story that kind of brought you into this space. Do you want to share this with our audience?
Yeah. You know, I mean, when it comes to women's health and women's sexual health, my journey, you know, to where I am now, to actually, like you, be able to influence hundreds of thousands of people is a personal journey in addition to a professional one. I was diagnosed with early menopause at age 38 after a significant family tragedy, mm-hmm. and where we lost our son in a traumatic accident, and that plummeted me into an early menopause at 38. And my husband and I at the time, we wanted to try to have another child, but I was told I was, completely early menopause, early ovarian failure. And I was told I would never be able to have another child again on our own. And that was devastating. And here I was, an Emory University-trained, board certified gynecologist and obstetrician. I had nothing in my doctor's bag. And this is where it literally took me on a journey around the world looking for answers. And so I went from early menopause, infertile, told I would never have another child again, also well over 240 pounds at some time, with significant stress-related hair loss all the way back to my crown. Wow. And to having a beautiful daughter at age 41. Who is now 11. So I'll be 53 this year with an 11-year-old. So exciting. I have to stay on top of things. And then to reclaim my health and my, my life, like completely reverse menopause. And we don't talk about that in menopause, in medicine at all. And then age 48, that kind of took me on another journey that dug me deeper into a second menopause, and then pulling myself back out of it. And that's what I really write about in the Hormone Fix, recognizing that it's more than about estrogen, progesterone, testosterone, even DHEA. It's really about the major hormones that drive us into health or into disease, such as cortisol and insulin and oxytocin. And so that's where I built a dietary program, which I call the Keto Green Way, using the best of ketosis and alkalinity from a functional medicine perspective, like really empowering balanced hormones that are grounded, good grounded health with adding in the concepts of bringing our body into ketosis, the fat burning state, that in the perimenopause and menopause, we do a lot better. So, seriously, I'll share with you that I went from, pulling myself out of menopause at age 38, having a baby at 41, to plummeting back in post-divorce at age 48. And I talk about that, where the underlying stress, trauma, PTSD, defeats your oxytocin level, defeats your ability to connect. And that's why so many people who have lost a child, over 75% of us, end up in divorce. There's a physiologic reason to that. And I talk about that in this book. That's so important. If you've been through trauma, if you've had major life struggles, you want to understand, well, what happened to me? I talk about that in this book. And so then for me at age 48, going through that post divorce trauma, being the sole provider for my family, for my daughters, and then, leaving my practice to be that, present figure, constant figure in their life, because my ex-husband had a traumatic brain injury as well. And it was just that time that I needed to pull everything together. It was near bankruptcy, to be honest. Mm-hmm. And so learning this keto green way, pulling my body, developing this system that's more than what we eat, it's only 25% about what we eat, bringing that into our life, was able to transform my life, my family's life. So we have the best relationships that we've ever had in our entire life. I run a 7-figure business, and I'm inspired to inspire, educate, and somewhat entertain others to really reclaim their health. So.
Okay. Well, that's an amazing, especially the part, where you said that you got down from 240 pounds.
Yeah.
Usually
150. So, and kept that off for a near decade till my second, menopause, let's say. And then really understanding, like, oh my gosh, we can totally shift, at any age, shift our body and restore our health. So, yeah.
That's wonderful. That's amazing, because usually when people get up that high, they just the journey back is so hard that they just never make it. They just never make it. So let's go talk about vaginal dryness and vaginal rejuvenation. Let's talk about vaginal first of all, dryness, because I want to talk about the now, one of the things that most people assume is that it is just a situation for menopausal women, but actually it happens to younger women also. Does not. And what's the causes of that, both in the menopausal and non-menopausal women?
Yeah, well, early on, for younger women in their late 20s, 30s, we're really seeing a cause of endocrine disruptors and birth control pills and hormonal birth control. So, whether it's progestin IUD or progestin implants, all of those can affect. Also, tampons contain toxins, right? Pads we use, many of the clothes, fabrics, hygiene products. I mean, it's estimated that by the time a woman leaves the house in the morning, she's already put on at least 150, if not more, chemicals onto her body, many of which have hormone disrupting. So your body's competing with these exogenous, these additional chemicals. So your hormones are like, man, I got nowhere to go, right? It's like trying to get, what do you say, putting a camel through the eye of the needle type phenomena of your hormones.
Yeah. So these are all basically what you're describing is something I guess I've heard referred to as endocrine disrupting compounds occurring. That really there's no escaping the reality of it. There really is no escaping it. So what happens on a anatomical and physiological level when a woman is experiencing vaginal dryness and basically vaginal atrophy? Well, what goes on there and in that process?
Yeah. So with vaginal dryness and vaginal atrophy, the normal hormone changes that are occurring is that, in our mid 30s to early 40s, we start to get a decline in progesterone and a slight decline in estrogen. And so with this decline that we're getting, we often experience these symptoms of irregular cycles, PMS, like I always tell my clients, who have PMS, I'm like, if you only hate your husband 2 weeks out of the month, it's probably your hormones and not so much your husband, right? Mm-hmm. Sure, he's to blame, but maybe not for all of it, right? If it's only 2 weeks out of the month. Excuse me.
Sure. It's okay.
So passionate. Okay. So, let me gain my voice back a second here. Could I have water?
Yeah.
So normally we see that decline of progesterone, a decline of DHEA, and a decline of estrogen. And from there, that creates a thinning to our vaginal walls, a loss of the muscle mass, a loss of the elasticity, a loss of the rugation, a loss of the normal function and flexibility of the vaginal walls. And so this is certainly a normal aspect of aging to a degree, but you add in these other endocrine disruptors, you add in these other factors, and then the symptoms are expounded. And what happens here, it's really important to understand, is that what happens is, while hot flashes eventually go away in this perimenopause, menopause, vaginal changes do not. They continue to get worse unless we do something about them. And what happens here is, like, hey, you stop wanting to have sex, which I tell women all the time. If you have pain every time you do something, why would you want to do it? It's like a guy going up to bat and he gets hit by the baseball every time he's up at bat. Like, you're not going to want to play baseball, right? There's no way you're going to want to play baseball. But for women, this happens. We have pain, we have discomfort, and we want to have intimacy with our husbands, but then we're continuing to have this pain, and if not just during, after, discharge, irritation, bladder infection, odor, and that's just like, that's negative feedback all the way around. So again, why would you want to? And it's important to understand, okay, well, these can be natural hormonal changes because we increase the alkalinity of the vagina as we get older. We lose the natural flora. We lose the natural secretions and the strength in the hormone and the tissues. So we lose pleasure and orgasmic ability. So we have to work on that essentially. And so through my experience as a gynecologist and a hormone expert, using hormonal therapy, absolutely, using my product that I created called Vulva, which is a natural anti-aging cosmetic cream for the vulva. I mean, like no one thought of that, right? Like no one said, okay, we need to take care of the pelvic floor. I want people to think about that because it creates bigger problems than the wrinkles around our lips and around our eyes do, right? The loss of elasticity, the natural aging that occurs here is occurring down there. And it's absolutely fine, but we have to do something about it, right? And we can through natural anti-aging technologies and pelvic floor exercises and your regular perineal massage and regular, communication with intercourse, and that makes a difference in our lives for sure.
Okay. So when these kind of changes, and I want to get back to this, the anatomical changes, because how severe can that thinning of the vaginal walls get?
Yeah, it can get really severe. And so many times I hear from patients where, clients who are using my product, they're like, Dr. Anna, I wasn't able to have a vaginal pap smear. And now because of your product, I'm able to have my exams without pain, without discomfort. And it can get so we get this thinning of the vaginal walls, we get this loss of elasticity. So it can cause discomfort. And especially like, okay, we're held off from having sex. And often it's a combination, right? Women start to experience vaginal dryness when men are starting to experience some erectile issues. Mm-hmm. And so then intercourse becomes very, very difficult and vulnerably painful to the couple, right? Because one doesn't want to hurt the other. One doesn't want to, affect the ego of the other. It's such a vulnerable time period that oftentimes what happens is couples don't talk about it. They end up sleeping apart, not having intimacy, sleeping in other rooms. And it's devastating. It doesn't have to be that way. You can read the testimonials on my site from even women in their 60s, 70s, women who've had breast cancer, and the stories of men that have helped them along the way.
Yeah. Well, this represents not just a physiological thing, but also a loss of both physical and emotional intimacy.
Yes.
And so that loss of intimacy, I think that maybe you can share with us some stories of women, and also how it affects men in terms of depression, self-esteem, relationship, and even the divorce.
Yes. Yeah, absolutely. And often what happens here, I mean, there's so many issues that are critical to mention here. And I've treated many women for sexual health and sexual health issues. And always I'm like, okay, I need to speak with your husband. This is a partnership process, because we've got to figure, both of you have to understand, like for her, natural physiologic, this is what we're doing about it. Hey guys, I need you on board because this is happening. And then also to find out from the male perspective, if he has Viagra or Cialis or something like that, and she has vaginal atrophy and she's struggling with pain and discomfort, it's like, that's a no-win situation there, right?
Yeah.
That's a no-win situation. That is not going to be good. And he's on testosterone and she's not being treated. I mean, where is that going to go? That's going to go to divorce and adultery, honest to God. And I've seen it happen over and over again. Let's call it thrill-seeking behavior, dopamine-seeking behavior. I often call it oxytocin-seeking behavior. So we have to recognize that. So it is a couples issue, and both need to be addressed, and all the issues need to be talked about, because the same thing for my female clients, like, okay, I've restored vaginal health function, orgasm, libido, drive, and then the husband's having issues. That's not good either, right?
Sure.
So we need to bring both along. And so creating natural interventions that help the couple, through education, right? And some good healthy products without all these chemical disruptors. Now that's where real communication can begin. So a couple can have intimacy for the rest of their lives. And you've asked me for an example. I think of this one woman, 67-year-old Kathy, and her story is actually in one of my blogs. And she'd been struggling. She was in her second marriage. She'd been married for 15 years and she was 67. And she said, intimacy was lost to them. And it was so important, but she came across Vulva and started using Vulva and was able to restore the sexual intimacy in her relationship. She goes, we have sex once a week. Sometimes we have intercourse, sometimes we don't, but we have sex once a week. And that just she's out hiking. They're doing more activities. They're involved with their community more, they're more altruistic. Life is better because, we have that feminine self-confidence back, the masculine self-confidence back, and then there's a partnership where we're better as a whole than we are as the parts. And I've seen that transform.
I think that people don't really understand that that these kind of issues permeate their whole life. Because you mentioned about being more active in your community, about being more enjoying life more. I think to a certain extent, actually, it probably would affect your ability to do business because you're a lot more positive about these things. All of those things, and the loss of physical and emotional intimacy. You talk about people sleeping in different bedrooms and they're just growing apart. And this would I think very often would lead to depression and divorce and just kind of a distancing. And it doesn't just stop there. It just kind of continues. You stop talking about stuff just in general, and there's more and more distance between the people in the relationship. So it's a real factor in that area. So there is a so let's talk about the therapies now a little bit, and there is a whole range of things that are available, and I'll tell you, for those of you watching and listening, I would go to Dr. Anna Cabeca's site, and I'm just going to put it back up there again, and there is just a wealth of information there. I was rather very, very impressed. Very, very impressed with the wealth. And it's not like sometimes you go to a medical site and it's highly technical, highly scientific gobbledygook that is hard to understand and decipher. And after you read it, you have no idea what it said. But let's talk about, just kind of go through the rejuvenation solutions, and kind of I'm looking at one of the articles that you wrote here, and let's talk about, first of all, the non-invasive solutions. Basically, you want to call it, you label them as low cost and non-controversial. So let's talk about them.
Yeah, because it does make a difference, right? Because we've heard about even laser therapies, vaginal rejuvenation, and we can definitely spend a whole nother hour, if not more, on this topic, right?
Yeah.
Because there's so much controversy around it, and what it stems from, the underlying issues. That's what's so important to get to. Why are we feeling bad about our vulvas, right? Why are we feeling bad about the vagina, right? Like, where does the negative effects of porn come in to influence our sex life in our bedroom, where it has no business being, right? We cannot compare. We cannot look for other examples. We know that porn decreases male testosterone levels, and it certainly does nothing beneficial for the relationship. So there's my side horse right there. I went side saddle on that one, mister. So, but to talk about, low cost and non-controversials, it's just in general, pelvic floor massage, right? That's one thing in general, just, massage, self-pleasuring. It's important. It's part of the aspects. Our clitoris, women's clitoris, contains 9,000 nerve endings. 9,000 nerve endings derive from the sacral floor, the sacral S2, 3, and 4 sacral nerves. And that innervates our lower extremity, that innervates, it's critical for balance and also a lot of sensation and the structure function of the pelvic floor. S2, 3, and 4 innervate the clitoris, the pudendal area as well. So igniting those nerve endings is beneficial, even through gentle massage, right? Slow, soft, gentle massage. So that's one thing. Using coconut oil, world's greatest. My gosh, it is better than sliced bread. What can I say? Coconut oil. I mean, seriously. How do you not love it, right? Smells good, tastes good. I mean, there's nothing better. Keep one at the bedside is what I tell my clients. Use another one in the kitchen for cooking, but definitely keep one at the bedside. And especially as we're getting older, and I teach people to make just a natural lubricant with fractionated coconut oil, because it's liquid at room temperature, and aloe vera gel that's liquid, because aloe vera is very healing. And especially as we're getting older, that tissue is more sensitive, again, from clitoris to anus. So using that and adding a couple essential oils, like something that smells good to both of you, frankincense, bergamot, rose, those are my three favorites right there. But you got to figure out what you like, right?
Sure.
And what resonates well for you. So you've created this beautiful lubricant / moisturizer that you can use for perineal massage, whether you're having intercourse or not. And light touch is critical. And something I teach in my program called Sexual CPR is about having slow sex, right? Just going to the energetic sex versus sports sex. And that's really important relationally, especially as we get older, right? You know what I'm saying?
Oh, well,
right?
yeah. I've heard it described. You describe it so eloquently. We've heard it. I've heard described as, especially the quickie, as taking one for the team. Versus the more full on course romantic sex that you're taking your time and spending a lot of time just enjoying pleasuring your partner and yourself at the same time. So
Yeah.
So,
I mean, you're looking at a 9-course meal versus chips and salsa, right?
Yeah.
Or nacho grande, right?
Yeah, and sometimes the natural grande is just fine.
Both is good. Exactly. Both is good. Both are good.
Both is good. Yeah.
There we go. All right. I'm hungry now. I don't know about anyone else.
So now you got another term you can use, taking one for the team.
And so many women will tell me that, well, I'm just powering through it. I know that it pleases him. Well, I will tell every woman who's listening that I guarantee you, if he knows that it's just, whether you say it or not, he knows that you're not happy, it's not bringing you pleasure. It's, like you will that energy resonates into the relationship. And he too is going to want less and less and less. And so first of all, for women listening, you never have to power through. There's always a solution. If you're not getting it from your gynecologist, like definitely dig into my blogs. I mean, I am passionate about women stopping the suffering that women are experiencing and improving the longevity of our relationships, because during this 35 to 45 time, that's peak divorce time. Right? Because we're experiencing these changes and we have no way to express or to communicate them, or we're getting here, take an antidepressant here, which is going to make sexual function worse, by the way, here, take a birth control pill, which is going to make sexual function worse, by the way, does nothing to heal the underlying issues. And then where are we at? We're at decades of discontent, or we're in divorce facing a different face on the same problem.
Sure.
Exciting.
Yeah. So just for those of you listening, just so you know that there's Dr. Anna has a huge section on her website that talks about all sorts of different kinds of lubricants, and it was very informative, because when I got there, I was like, oh my gosh, I didn't realize there were so many different variants. There's actually basically 4 different types of lubricants, and they all have their particular features, and some have I think are better than others, and also things to avoid. In a lubricant. You look at that. There's some things that you talk about that you really don't want, because they're toxic to the vaginal walls, or they may dissolve a condom or things like that. So let's talk a little bit about.
I want to interrupt there, because it can cause also pelvic swelling, irritation, infections, and then, of course, like you said, endocrine disruption. I mean, even aspartame, which we know is neurotoxic, right? Sometimes in a lubricant, and petroleum, also a huge hormone disruptor, not just for the woman, but for the man as well. So, it's not just about, female health, it's also about male health. And much of what's in over-the-counter formulas and some prescription solutions are quite toxic. Yeah. Thanks for bringing that up, because we don't realize it, and we think that, oh, well, this is what's the status quo. This is the latest and greatest.
Yeah. If it's on the shelf at CVS, it's got to be healthy. It's got to be good for you. So let's move on to more what you label as invasive bioidentical hormone replacement therapies, which I know I want to get you back on for, because that's a whole subject. But just kind of briefly touch on those, and medically warranted surgeries. So we'll touch a little bit about that.
Yeah, I think that's great. And, there's so much vaginal, like there's, a great ability to prescribe vaginal hormone. Your prescription things that are available that your doctor can write, certainly vaginal estrogen. We want to use bioidentical, like an estradiol, versus anything synthetic or conjugated. We want to stay clean on that, and we want to avoid synthetic progestins. We want to use bioidentical. I can't emphasize that enough. Bioidentical is, there is no synthetic that is the same as bioidentical, right? Yeah. And the second aspect of that is, like in thinking of besides estrogen, there's vaginal DHEA, and there's testosterone. Your doctor can prescribe a combination of DHEA, testosterone, progesterone, and maybe a tiny bit of estrogen, and for vaginal use to help restore the function and structure of the pelvic floor. These combinations can be made, and there are prescription forms that are available separately, like for estradiol, or, for example, Intrarosa for DHEA. So there's some with excellent results with vaginal therapy. So there's that. And then that brings us into, surgery. There is a huge increase in pelvic floor surgeries. Go ahead.
No. I just want to touch back. How these bioidentical hormones, how are they administered? Pill, or is it injections? Or is it a lotion? Or gel?
There are a lot of ways to get it. Certainly there's pills, creams, injections, pellets, vaginal suppositories. When we're talking, because in order to get the vaginal effect, we need local. So, with Vulva, for instance, I created this anti-aging topical cream for the vulva that's applied topically, clitoris to anus. It contains plant stem cells of the alpine rose. It contains DHEA. It contains emu oil, coconut oil, things like that. Fabulous cosmetic, anti-aging cosmetic for the pelvic floor. vaginal prescription medication all need to be prescribed by your doctor. And typically I recommend it be prescribed in a troche, something that's like a small lozenge that can go inside the vagina. So you're not getting discharge, like a lot of cream, etc. That makes it inconvenient. Otherwise, there's vaginal, can be a vaginal cream, or a compounded topical formula can be prescribed and customized. So there's those ways. Bioidentical hormones in and of itself, again, there's oral hormonal forms, which I don't recommend long-term, especially over age 55, because of the increase to some inflammatory markers that we often see. So we don't want to use, and their first pass metabolism is through the liver. We bypass that with vaginal administration of hormones. So it's much, much safer. Okay. And that's always better, right? Safer is better.
Yeah. Okay. So let's talk about, and one of the things I just realized we didn't really talk about, and I want to kind of just take a step back, is that when you have vaginal atrophy, urinary incontinence is a huge issue for women, especially if they've had vaginal births. And that is something that some of these, can you just kind of touch back on this a little bit?
Yeah. So, again, I've had 4 big children, with the one almost 9 pounds, like just a 0.4 ounces or 4 ounces shy of 9 pounds. And so, urinary leaking, loss of bladder function, loss of the elasticity or the normal strength of the pelvic floor is a huge issue that takes women to surgeries. And what do we hear about all the time? We hear about mesh erosions. I mean, I don't know if you remember the billboards. If you've had mesh erosion, or the, major class action lawsuits against docs for using mesh in the vaginal tissue to help support pelvic floor repair. Well, in order not to get those, and touch wood, I've never had that, but in order not to get those risks, or to treat women who had that, and I needed to repair erosion from, incontinence surgeries, or if I'm preparing them for incontinence surgeries, I started using, for example, vaginal testosterone. And that would help significantly improve the tissue, so much so when they would come back for their pre-op for surgery, they're like, "Doc, I no longer have incontinence issues." I'm like, "Man, then I can't operate," So, so sad for me, but really good for them.
Sure.
Just, the body's amazing capacity to restore itself, especially vaginally, because there's so much good, healthy blood supply to the vaginal area that we can, a little bit goes a long way in vaginal hormone therapy. So yeah, incontinence is a huge issue that affects our quality of life. So that always with pelvic floor exercises.
Yeah, in talking to men about it, they don't even know. A lot of men don't even know that their wife or girlfriend, significant other, is actually has urinary incontinence issues. It's just kind of because they never ask, and that's not something somebody usually volunteers, and they may be wearing a pad, they may be wearing a diaper or something like that, and and they sneeze, and they basically literally pee in their pants.
Yeah.
Which has got to be, socially. I mean, you can imagine you're at a party and all of a sudden that happens, and it's kind of like, well, you're self-conscious the whole night.
Yeah. Or, I mean, that keeps us from exercising, right?
Sure.
Because if we're doing yoga or doing spin class or whatever, and we leak, I mean, that's devastating. But it can be reversed. I'm just saying it can be reversed naturally. And that's one of the reasons that I encourage pelvic floor exercises and the use of Vulva as soon as possible, because we see that transform. But it's also the number one reason that caregivers put their loved ones into nursing homes. Incontinence is the straw that breaks the camel's back.
Oh, I can imagine. So let's talk about the controversial things.
We haven't already? What?
No, we haven't got to that one. What you learned, list is controversial. So the FDA has apparently come out on positions on some of these therapies in terms of, and maybe we'll touch on those. Let's talk about platelet-rich plasma and with and without stem cells.
Yeah, well, again, this has been a really emerging area. When we talk about FDA coming down on it, certainly has come down on many of the laser rejuvenation therapies for vaginal health, and like, hey man, it's not indicated, or we're really not sure, whatever, that's an issue. PRP, something that, came in, like in my practice, I used to do G-shot injections, injecting collagen into the G-spot. And I did that quite successfully for a significant amount of time. It helps patients experience sensate focus to increase pleasure, right? Now we have PRP with stem cells that can be injected into the G-spot, for instance, to help with rebuilding that area of sensation and sensitivity. And also, again, for sensate focus, right? More sensitive, more ability to be focused on and present at the time of play. So in those areas, there's been some good results, but it's still relatively new. I think PRP's been, we're probably hitting over, trying to think. So I know I was doing 2000, maybe we are at 10 years already with PRP. 5 to 10 years for PRP already, actually.
Yeah, because I think oftentimes you hear it referred to as the O shot. Yeah. Yeah, I think that's a trademarked term at this point, so you can't use that. So let's switch topic. Let's go talk about some of the radio frequency and CO2 laser therapies, and what's your position on those, or energy devices.
Yeah. So, we think about, looking at the vaginal and vulvar area, the same as we think about facial area, right? We know with YAG lasers, CO2 lasers, we're resurfacing the top so that we get an increase in collagen, right? So that's one way to, and that's been approaching, physicians have been approaching the pelvic floor in the same way, using these very similar technologies, and clients often get beneficial results that are temporary. Mm-hmm. So we always need to do something with it.
Yeah. So, and a lot of these therapies depends on the person individually. My assumption is that it's not like it's done and it's fixed forever, that you depending on how your body processes it, you have to go for retreatments. And
you do, almost always.
Yeah, because it's not something that really happens all of the time.
Yeah, and it makes sense. Just like facial rejuvenation procedures, right? It's never one and done. Maintenance is key, right?
Sure. So then,
you're like, I don't know what you're talking about.
What's that?
You're like, I don't know what you're talking. I'm not going in for any facial laser stuff. What is?
Oh, no. I have a great anti-aging doc, Dr. Carmen Mora, and I've been her guinea pig from a number of things, including ozone and other things. So yeah, she actually she's done some great stuff for me, and so I'm very, 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 very thankful. So I want to finish off on the really hot item that I want to talk about, the Barbie doll vulva. What is that?
Well, I think that's the misconception that young women and women of all ages are having about what their female anatomy should look like, right? Mm-hmm. So it's that Barbie doll vulva phenomenon, right? And where is it coming from? It's coming from the porn industry. It's coming from, models and Photoshop, right? It is not realistic. And it's just like as porn is as realistic to sex as an Arnold Schwarzenegger movie is to real life, right? There's not. And each woman needs to understand, just like the orchid flower is all uniquely different. Each one is beautiful, but everyone is different. The same with the vulva. So that is my really big pet peeve, is I've had women who have come in and said, am I normal? One side's longer than the other. Is this normal? Is that normal? Or whatever. I'm like, look, you are perfectly made. This is absolutely healthy. This is normal. Versus going into someone who's doing these surgeries and be like, well, we can nip and tuck here. We can nip and tuck there to give you this essentially Barbie doll vulva. And that is devastating. Because it's not long-term. And the side effects, decrease in nervous sensation, scarring, et cetera, can be more damaging. And I have lectured on vulvar vaginal rejuvenation. In fact, I had a plastic surgeon whose expertise was vaginal rejuvenation actually argue with me on this topic. And it's like, if a woman wants it, I'm like, well, underlying reason why she wants it. Why does she think she wants it? Is her partner saying, hey, this doesn't look right? I mean, like, my opinion, like, accept me as I am. It all works well,
you need
right?
a new partner.
There's something deeper to be worked on there, right? Is it because his influence of porn is affecting her sense of self? That has to be addressed. It's powerful discussion to have. And I really want women and men know, I mean, like, we are all created differently. We are like flowers in a field. Each one is different, but each one is exactly designed perfectly. So and I have done vulvovaginal repairs on clients, but there's been reasons. One had cancer, another had a significant amount of HPV. And so there are reasons to do it. But the cosmetic has, in my experience, not a long-lasting beneficial effect for the relationship, the woman. I mean, there's exceptions, of course. And again, there's a temporary fix, but I know, and again, I talk about this in my book too, in the Hormone Fix. I have a whole vaginal health chapter. And of course, I'm always blogging about it. There's a deeper reasons that we need to address and to fix so that we have, a better overall wholeness and quality of life. And so. Sure.
So I want to ask you one last question in this area, and then, like I said, I'd love to get you back, and we can talk about some other things in the future. Why, from a personal standpoint for your patients, why is vaginal rejuvenation important? Why? And what happens if you don't?
Yeah. Well, I think our pelvic floor health affects us for the rest of our life, leading to incontinence, leading to dryness, irritation, thinning, discomfort. I mean, it can hurt to use toilet paper. So vulvovaginal health affects the quality of our life. And again, because the nerves that innervate this area are it's a feedback system. So we keep this area healthy. We have good, healthy blood flow and good, healthy nerve supply. That affects our entire, circuitry, right? Everything is connected to another. So it's not just about sexual health. It's much more than that. It's functional health. It's relational health. It's emotional health. And it's self-confidence and quality of life. Yeah.
All right. Well, I want to thank you, and let's kind of go again, kind of review, because I know we talked about it at the beginning of the program. Let's talk about some of the things that are available on your website, drannakabeca.com, because like I said, I think it's a wealth of information and value to people on it. So what kind of give us a big overview about what you got on your site? And there's a lot.
Yeah. So we definitely have a little bit for everyone, but, I really focus on menopausal health and these key areas: sexual health, hormones, vaginal health, and also my keto green way that I talk about in the book. So how we eat and how we live, diet is much more than just about what we eat. It's a lifestyle too. So my keto green way, I talk about that a lot in my book, and I share recipes. And I'm very active in social media at Dr. Anna C on Facebook. And I have a keto green community that's very, very active. And I just think it's I want to educate, inspire, and, hopefully get you to smile too, because we can't take it too seriously, right?
That's right. That is absolutely correct. Well, folks, this is Oris, the old guy from www.oldguytalks.com, talking to you about something that, is not discussed often enough: vaginal atrophy and vaginal rejuvenation with Dr. Anna Cabeca, triple board certified gynecologist from Emory University, and just an expert, not just from theoretical, but from practical knowledge of having helped thousands of women deal with this. And then the beneficiaries of those is thousands of men like you old guys. Take care. And remember, it's all about creating a kick-ass life for yourself and those that you love.
If you are interested in creating a kick-ass life for yourself and those that you love, then become a member at oldguytalks.com and get access to the cave area, where not only do I have my interviews with doctors on cutting edge therapies for erectile dysfunction, but I will have other things that are posted in there that will help you create that kick-ass life that you want for yourself and others. And we're going to be talking a lot about different kinds of vices and virtues. So opt in and become a member